It's important to talk about prediabetes because 10% of people with prediabetes will be diagnosed with diabetes each year in the United States. And we know that there's a lot of crossover between the risk for developing diabetes as well as cardiovascular disease. So, the risk factors for prediabetes, such as being overweight, lack of physical activity, poor diet, are also associated with increased risk of cardiovascular disease. So it's really, really important that you understand what your blood sugar levels are, what your A1C is, so that you can use that to tailor and create a program that reduces your risk of developing diabetes as well as cardiovascular disease. As women, it's so important that we know how to advocate for ourselves when we're speaking with a healthcare provider. And so today I want to share a technique that I use with my clients to teach them how to advocate for themselves. It's called mama bear advocacy. I want you to visualize a mama bear. Everybody knows how protective they are and how willing they are to advocate for the ones that they love. So when you have an intuition that something is going on with yourself and you believe that you need to get help and get into the healthcare space, I'm not talking about an emergency situation. I'm talking about those things that kind of develop and you're thinking, something's going on here. I think I need to get in with my doctor. What I want you to imagine is if this was your beloved friend, your beloved child, niece, nephew, or your beloved pet, something so dear to you, and you knew that they needed to get help, what would be the first thing that you would do? This technique works because it's no longer personal about yourself, where we can sometimes as women hesitate to put ourselves out there, but we are usually very, very willing to put ourselves out there for the ones that we love. So borrow on that natural empathy and compassion that you have and use that to advocate for yourself the next time that you need to engage with a healthcare provider. 4 things that you can do to reduce your risk of developing prediabetes. First is movement. You should be moving about 30 minutes through the day, 5 days a week. Secondly is integrating healthy foods like fruits, vegetables, and healthy whole grains. Third is reducing our portion size. And the fourth is developing community, because we know that change can be difficult and you need a support system. So my passion is helping people to overcome barriers and to achieve their goals of integrating healthy lifestyle choices and reducing their risk of developing prediabetes and diabetes. I hope that you'll follow along and learn more. Let's talk about blood pressure. So I think that most people understand that we need to have our blood pressure under control because it increases our risk for cardiovascular disease. And cardiovascular disease, heart attack and stroke remain the #1 leading cause of death for women. So it's really, really important that we help to reduce our risk of developing cardiovascular disease. And one way we can do that is to control our blood pressure. So according to the American Heart Association, our blood pressure should be below 120/80. So 120/80, that is the top of normal. So when we think about blood pressure, I want you to imagine your cardiovascular system as a plumbing system. And so you can think of your veins and arteries, essentially, this is simplistic, of course, as pipes. And your heart is a pump. And so your heart is pumping and working to move blood to get nutrients and oxygen to all of your tissues in your body. And so when your blood pressure is high, there is more tension in those pipes and your heart is working harder to get that blood and the nutrients out to the tissues. So what we want to do is to help to lower that blood pressure, lower that tension in the arteries so that the heart has an easier time of moving blood. When the heart works really, really hard against that pressure, the heart begins to get stressed. And that can lead to issues like heart failure and other types of heart disease. Also, when the blood pressure runs high and there's that tension sort of all the time in those blood vessels, the blood vessels themselves can begin to get damaged. And then we start to see that the tissues are getting strained because they're not getting the nutrients and the oxygen that they need to be healthy. So the best way to get a reading for your blood pressure, obviously, is to check in with your physician, your primary care provider. There are some options for checking your blood pressure at home. So research has shown that the blood pressure cuffs that you can purchase that go up on your arm actually are very, very accurate. And you can use this as a starting point to measure your blood pressure. There's also machines at your local pharmacy. And again, this is a great place to start. Check in with your primary care provider and get a reading on your blood pressure. See what you can do to bring down the tension in your circulatory system so that you can live a long, happy life and to avoid cardiovascular disease. Common risk factors for prediabetes include being overweight or obese, following an unhealthy diet, lack of physical activity, having a family member that has prediabetes or diabetes, if you yourself had gestational diabetes, or having polycystic ovary syndrome. There are no symptoms for prediabetes, so it's important that you're checking in with your primary care provider if you have these risk factors and making sure that you're having a routine blood test that can inform you if you have prediabetes. One of the things that I'm really passionate about for women is finding ways that we can better advocate for ourselves. So I have a technique that I teach my coaching clients, and this is a concept of borrowing from a hero. So sometimes when we're in a difficult position, we kind of are falling on our habits and the techniques and things that we already know and are familiar with, but they may not be getting us our best outcome, especially when we need to have a difficult conversation. And so one of the techniques that you can do is this concept of borrowing from a hero or somebody that you think would do a really good job in that situation. And so you can brainstorm and think, okay, something needs to happen. What would my hero do in this instance? How would they act? What are the behaviors that they would exhibit so that I can get the best outcome? So sometimes when we need to advocate for ourselves and we know we don't quite know exactly what we can do, we can imagine what our hero would do. And that can give us some clues of maybe our next best step. Here are 4 things that you can do to reduce your risk of developing prediabetes. First is movement. Integrating activity throughout the day, 30 minutes of activity 5 days a week helps to normalize your blood sugar levels. Second is integrating healthy foods like fruits, vegetables, and healthy whole grains. Third is reducing portion size. And then fourth is developing a support network. We know that with the right plan and the right community, you can integrate change and reduce your risk of developing prediabetes and diabetes. Let's talk about ways that you can check your blood pressure at home. So research has shown that the blood pressure cuffs that you can purchase at the pharmacy that are digital, that go on your upper arm, are actually very, very accurate. So this is a really good way for you to get an idea of what your blood pressure is running at home, and if you take medications, to monitor your medications and see how well they're working. I have some suggestions on ways that you can monitor your blood pressure at home. So it's a good idea to stagger it, so that maybe on Monday, you check your blood pressure in the mornings. Wednesday, you could check your blood pressure in the afternoon. Friday or over the weekend, checking your blood pressure later in the evening. You can pick the days, but the concept is that you get some readings throughout the day because we know that our bodies have a cycle and a rhythm. So where you may have a different reading in the morning than you have in the evening. This is very, very helpful because when you meet with your provider, your primary care provider, they'll be able to give you some suggestions and maybe get some ideas about the best way for you to manage your blood pressure. It's a great idea to start checking that at home because we really want you to know your numbers so that you can lower your risk of cardiovascular disease by knowing your blood pressure. So prediabetes is a condition where a person has elevated blood sugar levels, but they're not quite high enough or haven't reached the level yet of being diagnosed as a diabetic. So it's actually very common. In the United States, 1 in 3 adults has prediabetes, and worldwide, over 700 million people have prediabetes. It's really important to know that there are no symptoms of prediabetes. You wouldn't know that you had it unless you had a blood test. So it's recommended that if you are overweight or at risk for diabetes, that you're having routine screening with your primary care provider. So I'd encourage you to check in and get screened for this really important condition. Let's talk about heart disease. It's important for every woman to know that cardiovascular disease, primarily heart attack and stroke, are the leading cause of death for women. So it's really important that you understand your individual risk And so thankfully, the American Heart Association has some suggestions on ways that you can begin to understand your individual risk. And this is a concept of knowing your numbers. So knowing your BMI or understanding your height and weight, knowing your blood pressure number. Your blood pressure should be below 120/80. You should know your cholesterol numbers, and you should know your A1C. A1C is the marker that we use to determine if a person has diabetes and how well it is controlled. So the best way to understand and get these numbers is to work with your primary care provider and talk with them about your own individual risk of heart disease and how you can improve that. Because the good news is, for the most part, cardiovascular disease can be prevented through lifestyle intervention. So I highly encourage every woman to know your numbers. So if you have prediabetes, you may be wondering, how do you reduce your risk of developing diabetes? So if you're overweight or obese and you've been told that you're pre-diabetic and you want to lower your risk, you need to lose about 5 to 7% of your current body weight according to the CDC. So we know that that can be done through integrating healthy lifestyle choices such as increasing movement, integrating fruits and vegetables, and reducing portion size. We also know that a support system and having the right program and the right accountability is really important as well, because making change can be difficult, but the good news is that with just a small amount of change, you can have a significant impact on your risk of developing diabetes later. There are a handful of things that you can do that will reduce your risk of developing breast cancer. First is exercise. We know that a sedentary lifestyle increases the risk of developing breast cancer. We know that by adding fruits and vegetables into the diet, you lower your cancer risk. Consuming alcohol and smoking increase your risk of developing breast cancer, as well as being overweight after menopause. So I always say that action is the antidote to anxiety. So it's nice to know that there are a few things that you can do with lifestyle modification to reduce your risk of developing breast cancer. Why is exercise so incredibly important for diabetes and prediabetes? So we know that in our bodies, we use sugar as energy. And one of the places that uses a lot of sugar is our muscles. So when we go to move and exercise, our body takes all of that sugar and uses it for fuel to power our muscles. So one thing I like to encourage my patients to do is just to integrate a little bit of movement after each meal. It doesn't have to be a lot, but just walking for maybe 5 to 10 minutes after each meal will, number one, help to lower the blood sugars, integrate that physical activity, which we know is also really important for the brain. And then just that little bit broken up through the day, you can reach your 30-minute goal, but you don't have to do it all at one time. Just that little bit of movement after each meal gets those muscles burning up that sugar and helps to normalize them, which helps to lower your risk of prediabetes and diabetes. Action is the antidote to anxiety. One way that we can make ourselves to feel empowered and that we will better advocate for ourselves in the healthcare system is to become the owner of our most important medical information. So what I would encourage you to do that when you are seeing your provider, ask for a copy of the results of your imaging, blood work, biopsies, or if you are seeing a consultant, to obtain their consultation note so that you have those results. Keep those together in a folder or a binder so that when you are moving through the healthcare system, you have ownership of that information and that you can share it with each provider. This will help you to have highly productive visits with your provider so that they have the most pertinent information each time that you see them. I have created a worksheet for you. This will help you to brainstorm on the most important information to put together, questions that you may want to think about ahead of time, so that each time you see a provider, you're getting closer to the answers and the solutions that you need and that you deserve. Let's talk about fiber. We couldn't talk about prediabetes and diabetes without talking about fiber. Fiber is absolutely amazing when it comes to helping to normalize blood sugar levels. Foods that are high in fiber help to slow the digestion of sugar, not only in that food, but in other food as well. So I would highly suggest that you be looking at the fiber content of each of your foods and making sure that you have high fiber foods integrated with every meal. This will help to normalize your blood sugars, help to lower your A1C and reduce your risk of prediabetes and diabetes. So the conversation around breast cancer is personal to me, as it is, I'm sure, to many of you watching the video. So when we consider that 1 in 8 women will develop breast cancer in their lifetime, and behind skin cancer, it's the most common cancer in women. Every 2 minutes in the United States, a woman is diagnosed with breast cancer. The good news is that breast cancer, when detected early, in most cases is very treatable. And there is a screening test available. It's called a mammogram. Mammograms are recommended for women above the age of 40. So if you are a woman above the age of 40 and you haven't had your mammogram yet this year, it's important that you're talking with your primary care provider, talking about your risks and making sure that you have this really important screening test.